Hey Grd12s, how you doing? Alrighty, so this is the last recorded video from me for the rest of this term until after exams, and then hopefully I'll be able to see you in by face to face if the whole world doesn't fall apart by then. Alrighty, so before we continue, I just want to say like good luck for your June exam. I don't think it will be that tough. Not that I've set it or anything, and it's due on Monday, but we're okay. All right, so let's look at the last little bit of contraceptives. So last time we did natural methods, and we did barrier methods. So natural, as in human beings behaviorally need to change what they're doing during ejaculation or paying attention to the woman's menstrual cycle or ovulation cycle for the matter, and then the barrier in terms of something physical which stops sperm from getting into the uterus and allowing for fertilization to occur in the fallopian tubes. So we're going to start with the chemicals. First chemical we're going to do are spermicides, then we're going to do oral contraception, sorry, and then we're going to do contraceptive injection, super scandalous. So let's look at spermicides. Spermicides are often actually found inside of government condoms. They are a really good source of spermicides. You can buy these. I don't recommend you use them too liberally, but they're jellies and creams that are inserted before intercourse. Okay, so it's used as a lubricant. Can kill a large number of sperm. Not all of them though, and that's why this is only about 75% safe. Okay, but however, there are no risks involved with having a spermicide while the entire situation is going along. Then we're going to have a look at oral contraception. I said contraception. Anyway, contraception. So let's have a look at the pill, okay, also known as the pill. There are a couple of problems with the pill, and if you are on the pill, whether it is for Planned Parenthood or it is to sort out your hormones within the body, either one can actually cause some major damage and long-lasting damage to the extent that you may not fall pregnant again if you do not take the right methods to get yourself off of the pill. So it's a hormonal medicine taken daily at the same time every day. Okay, you cannot take one at 8 o'clock in the morning and then the next one you take is 8 o'clock the following day. It needs to be within a 24-hour period. You need to have you need to have taken this pill. Okay, you cannot change it. I have friends and they're completely useless at this, so they actually set alarms on their phones and that reminds them to take the pill. That stops the secretion of follicle stimulating hormone and luteinizing hormone. Now, I want you to think before I give you the answer, hopefully, what hormone would inhibit the production of FSH and LH? Progesterone. Okay, so what the oral contraception is going to do is actually like stimulate the production of a lot of progesterone, and with the increase in progesterone, it means that the endometrium might be maintained, whatever there is, but at the same time, it will stop the production of a follicle, and if there's no production of a follicle, that means that there's no ovulation that's going to occur, which means that the endometrium can develop as usual, but there's going to be no moment of ovulation, which means no fertilization. But if an egg got through, that means that implantation would very much happen. Please also note that the oral contraceptives are known to work relatively well, even though I was a child who got around oral contraceptives. Somehow I managed to beat the pill. But to a large extent, there's also a couple of days where you should not take the oral contraceptive, and you'll notice that whatever pill you are taking, there's a difference in color. So it might be pink and white, orange and white, something, 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 something. The off-color shorter period of pills are actually just sugar pills, and that is to ensure that the body actually does go through the process of menstruation. Because having an endometrium lining for that period of time, the probability of that getting infected and actually causing more damage is extremely high. So at some point you do need to menstruate. Now, if something goes completely wrong, okay, I don't know, maybe your period is just too irregular, something like that, you can actually skip the sugar pills or the off-colored pills and go directly onto the next set of contraceptive pills. However, this is going to cause potential damage if you continue this. 2 months is okay. 3 months, no. 4 months, no. Just you'll end up in the hospital. So there is the chance that you can continue without actually having your period. But to a large extent, it's good for your body to flush out all that endometrium. So please let your body do what it needs to do. All right, so the ovulation doesn't occur. We spoke about that the endometrium does not thicken. Sometimes it's 99.9% safe. I'm the 0.1% over there. But there are some serious problems. So it can cause increased blood pressure, weight gain, diarrhea, vomiting, thromboembolisms, which is like clotting in the legs that causes the legs to swell up, especially in smokers, okay? All of these things really are a direct effect of taking a contraceptive pill or oral contraceptive, but it doesn't happen with all of them. So that's why there are different brands on the market. Remember that these are for free if you go to the local clinic. You can go and get yourself signed up for Planned Parenthood. You do have to give them all of your details, but your parents don't need to be aware of this, even though it is a good thing to alert your parents that you are potentially on this, because if you fall pregnant, I'm not going to be the one who has to answer about the fact that you didn't tell them that you're on contraceptives. Right, contraceptive injections. Oh, this stuff. This is so dangerous. Alrighty. Injections with progesterone, like steroids, are given during the year. Stops the secretion. I think it's like 4 injections, if I'm not mistaken. Stops the secretion of FSH and LH again because it increased progesterone. Inhibits the production of FSH and LH. It's about 99% useful, but can cause weight gain, mood swings, bloating, acne, headaches, breast cancers, osteoporosis. The list really does go on. It can actually cause a completely irregular period as well. And you can, like, I've known women who have taken these injections and their period actually goes for a full month. Their menses, which should only be 5 to 7 days, lasts for up to 30 days. And then you're going to suffer from anemia. Oh, it's absolutely insane. You can see that you're going to cause cancer, potential cancers as well, okay? This isn't for everyone, and you do need to go to your gynecologist and ask them about it first. Don't just go get injected. There are other things on the market that act in a very similar way. There are these sort of, I don't know what you call them now, like, I'm trying to think. It's like a tube that they actually, it's an implant just under the skin, and that increases the amount of progesterone as well in the body. But again, these have been known to cause mega problems. So, I mean, I don't know what is the best way out of all of these. In terms of chemicals, I can tell you the best way is the UID or the IUD in terms of physical. But chemical, there isn't really a fantastic option. Like the oral contraceptive is useful, but you know, how much damage are you potentially going to cause later on in life? I knew a woman who was on an oral contraceptive from the age of 15, and when she started to try and fall pregnant, I think it was the age of 35, she couldn't fall pregnant for about 5 years. And then eventually she went for fertility treatment, so in vitro fertilization, where they extract an egg out of the female when ovulation has occurred, and they extract semen out of the man, and then they allow for fertilization to occur in a petri dish, and then implant that back into the female when she is most prime to have an endometrium. And I think it took 5 tries, and then they got it right. But I mean, I'm trying to scare you now, but I'm not trying to scare you away from the actual contraceptive itself. I'm just here to tell you about how to be aware of what problems can occur. All right, so let's have a look at surgical methods. So we're going to look at the vasectomy and tubal ligation. Remember, the ligase was the enzyme that was actually able to break apart the DNA. So to ligate or ligase means to cut. Kind of goes hand in hand with the word lies. All right, so let's look at the vasectomy. This is the male one. Please also note, ladies, that one day if you want your man to have a vasectomy and he has a problem with it, tell him to man up, because the vasectomy takes, I think, 2 hours to perform, if that. And the man can literally get up directly afterwards and he can walk out. They go through the base of the scrotum as well, so that's a very minimal, like it's not very invasive. Or they can go through, I think it's the base of the hips or something like that. I think they go around that area over there, and it's just a snippy snip and boom. Okay, so the vas deferens is cut. No sperm in seminal fluid. So remember, semen is not the same as sperm. There's no sperm in the seminal fluid or the semen. Almost 100% safe, because a lot of the times we found that there is some semen or some sperm hanging around in the tubes, and then people have intercourse directly after the man's had a vasectomy, and the woman can still fall pregnant. So to a large extent, it is almost 100% safe, but sometimes things go wrong. It is irreversible sterility. Once it is cut, it is done for. There is no way back. So a man has to be extremely sure of when he wants to actually go through the process of a vasectomy. There you can see the vas deferens. Remember, it's attached to the epididymis itself, where maturation of sperm occurs. If they cut that, there's no transfer of sperm from the testicles out through the penis during ejaculation. Then we have tubal ligation. This is a way, and I'm not going to cover a hysterectomy in this lesson because that's more bigger problems when a woman maybe has hormonal problems or there's something wrong with her ovaries, okay? It is not recommended at all for a woman to go through a hysterectomy. The probability of you experiencing bigger problems later on in life, because now you don't have estrogen that is being released, keeping you in your woman-like state and allowing for testosterone to become your natural sex hormone, it can cause some serious physical changes within women. So to a large extent, please, if it's a complete must, then you must have a hysterectomy. But I mean, this is a better way. So this is when women say that their tubes have been tied or their tubes have been cut. So the actual fallopian tubes are cut and tied so that nothing can move around. Remember that the ovaries are still there, so all your hormones are functioning normally. It's just that there's no fertilization that's going to allow. No ova in the fallopian tubes, almost 100% as well, in case something is still floating around in there. And it's also irreversible. Like once you have cut those tubes, there is no way to mend them back together. Unless, you know, they cut even further apart from that and try and attach them again. But the probability of something going wrong is extremely high. Okay, so this is a summary of birth control. Don't write this down, but the next couple of slides, which I'm going to stream through, is a summary of all of this, and it's a nice way of comparing. What I want to maybe bring your attention to is a lot of the times, I've seen it once or twice, actually not a lot of the time, once or twice, they've asked you to compare a barrier method to a chemical method, okay? And you can use these, all right? So this is the natural method, withdrawal and rhythm. It looks at the procedure, methodology, effectiveness, and risk. Then we have the barrier methods. Remember, you can pause this and write this down or take pictures, whatever you feel is better. Then you have the chemicals, spermicide, oral, contraceptive injections, and then finally the surgical methods, vasectomy and tubal ligation. Alrighty, so I hope this has been useful, and I hopefully see your faces soon. Cheers!